Hi everyone, if you've just joined us, we're doing a quick Mentimeter poll while we're waiting for people to join us. So this is just to gauge, we've got quite a large number of people coming, we hope. So it'd be nice for us to know what boroughs you work in, what organisations you work in or volunteer for, and then we've got a quick question around intersectionality. I'll probably move it on actually, to the second question. Oh, that's the third one. So we've got a couple of minutes until we start. We're just inviting people to do a Mentimeter poll. So if you open a new tab on your laptop, or you can use your phones and go to www.menti.com and use this code 73667 and just tell us what organisation you work in or volunteer for. Brilliant, thank you. We'll just leave it a few more moments on this slide and then I'll move to the next one. That's great, thanks very much. Hello, welcome. We are going to start in a minute. I'm going to move on to the next slide. If you've just joined us, we're doing a quick Mentimeter poll. So all you have to do if you want to participate is open a new tab on your laptop or use your phone, go to www.menti.com and use the code 73667. And it's just so that we can get a sense of the organisations that you are volunteering in or work for, and also the boroughs that you work in. So I'm going to flip over to the next slide. If you could tell us where you deliver or volunteer, that would also be really helpful. Just leave it here for a few moments. That's great, thank you. And then finally, because we're coming up to 11 o'clock, the last one, and literally, oh, that's amazing. That's great. Okay, so it's 11 o'clock, so we're going to start. That's really helpful. I think that overlapping disadvantage, definitely that's a really key concept, interconnectedness, overcompensating, all of these themes, I think will actually come out once we start the presentation. So thank you, that's great. We're really grateful for you doing that. Okay, so my name's Sandra Vassiana. I work for an organisation called Partnership for Young London. I know that many of you are familiar with our work, but for those of you that aren't, I'm just going to say a little bit about what we do. Before I do that, just a little bit of housekeeping. So we are recording this session and we will send out the slides to you. There are some videos embedded in the slides. I'm not going to play them today. The slides will be a bit more detailed. This session lasts for 90 minutes and we have two speakers with us. So the first part of the session will be quite formal and then we'll move into sort of more of a conversation between the three speakers who are here today. So just a little bit about Partnership for Young London. We're an infrastructure organisation. Our work is essentially about influencing policy, and we do that in a variety of different ways. We connect with organisations through networking events such as this. We develop training and resources for our peers who work in the sector and in associated sectors, and we influence policy through our research. So obviously today we're looking at exploring work with young people through the lens of intersectionality. The format, as I said before, will be me giving a little bit of context, and then Maxine Willits from Young Brent Foundation talking about intersectionality and some of her observations with regards to the impact on young people, very much through that intersectional lens. We're also joined by Sarah Ahmed, who also works for Partnership for Young London. And Sarah is going to be talking about her lived experience as a young Black woman and how COVID is impacting her personally, but she'll also be sharing some of her observations around the impact on young people, and in particular talking about her experience as someone who has experience of the care system. We will have Q&As throughout the session, so you can put your questions in the chat, and then Troy, who also works for Partnership for Young London, will read those out when we pause with the discussion. So first of all, what does the term intersectionality mean? There are lots and lots of definitions. I've pulled this from a video by Kimberly Crenshaw, who conceptualized the term. And I think the useful things to bear in mind as we go through the session that Kimberly talks about is this overlapping, and that came out in your kind of responses to what intersectionality means to you. That's absolutely fundamental. It's the overlapping of different entities which, when joined together, can compound disadvantage. It's also useful to remind ourselves that it can be an overlap of privilege as well. And the other thing I think it's really useful to hold on to in this session is that central government, legislation, policymakers don't have a collective vocabulary to describe this process of overlapping disadvantage. And this is where intersectionality really helps us, because Kimberly Crenshaw has provided a way for us to articulate that particular lived experience. So where does this term come from? Kimberly Crenshaw, she's an academic. She was also a practicing lawyer. And back in the 1980s, she represented an African-American woman called Emma de Graffin Reed. Emma de Graffin Reed applied for a job with General Motors, and she didn't get it, and she felt that she was being discriminated against because of her identity. When Crenshaw looked into the case, she found and challenged them. They said, "We employ women and we employ Black people. Where's the problem?" But all the women were white and all the Black people were male. So it became very obvious to Kimberly Crenshaw that there wasn't just a race problem, and it wasn't just an issue of identity. It was the overlap of both of those lived experiences, which, when they interconnected, created a unique experience for Black women that was not recognized within employment. And she likened this to an intersection in the road where you have various roads converging, and at that point of intersection, if you're in the middle of that, you will get squashed. You will become invisible. So this is the metaphor that she used to articulate Black women's experiences. And since that time, the concept has been used to talk about other marginalized groups. And we'll talk a bit more about that in a minute, obviously. So, as well as talking about this overlap, another key aspect of intersectionality is identity. And Professor Paul Gilroy reminds us that when we're talking about identity, it isn't just how we feel about ourselves or how we're perceived and represented by others, although that is absolutely fundamental. It's also about our geographical location and about the historical context, and then the relationship with all of these different entities. We don't experience our identities in isolation. So it's really important for us to hold on to that. So just a quick overview. Some of the key aspects of intersectionality then are this convergence of different factors and how that can reinforce disadvantage. Intersectionality provides a framework for us to examine social positioning. It illuminates structures that uphold privilege. And remember, we can experience multiple forms of privilege as well as multiple forms of disadvantage. And we can't talk about disadvantage without also talking about power. It calls on us also to investigate the differences amongst particular demographic groups, as well as the differences between them. And also to look at the role of self-agency. There's no point in having all of this information if we can't put it into action to create social change. So ultimately, intersectionality it's a call for action. So these are two videos that you'll get when you receive the slides, and just a couple of points to highlight here. Terran Lee Crenshaw talks about intersectionality. She deconstructs the term, but one of the key questions that she also refers to that I think is important for us to be mindful of is, what is intersecting at any one time? What factors are intersecting? It isn't a tidy concept. So when we apply it, we have to ask that primary question. So it's important for us to think about that. And with the second video, Intersectionality 101, it's a really simple but effective case study represented by 3 young people. And the thing that I think is really useful from this is how, if you have protected factors and you are part of a marginalized group, you have no option but to be constantly considering your identity and how you're positioned within society. So positioning is also key, as opposed to if you're part of a dominant group where you're less inclined to think about your identity because you don't necessarily have to. So just, again, another quick Mentimeter poll. I want to talk about why I think it's important for the youth sector and associated sectors that provide services for young people to think about why intersectionality is relevant to us and how it can help us in exploring young people's experiences. So I'd just like to quickly do another poll to find out your immediate responses to that.
And yeah, for people who don't know how to use Mentimeter, just go to mentimeter.com. You can type that on your phone or on your laptop, and then just put in the code 73667. I'll put those instructions in the chat as well.
Okay. Yes, definitely. Right. I can see that we're having a few technical issues with one of our speakers joining us. That's really useful, what you're coming up with. Troy, can I ask you to ask Rianne to send the link to join the meeting to Maxine Willits? Thanks very much for doing this Mentimeter, everyone. It's really helpful.
It says Maxine's in the chat.
Is Maxine in the chat? Maxine Willits?
Yeah, Maxine Willits.
Okay, great.
Yeah. I'll send it to, I'll say that to Ren anyway.
That's really helpful, everybody. Definitely the key thing is understanding the lived experience of different demographic groups. We know that young people aren't one homogenous group. Representation, connection. Accessibility is also really key. So there's quite a lot of synergy with the things that you have pointed out and the things that we've highlighted within the organisation. It definitely, as you pointed out, provides a structure to amplify the voices of young people, particularly marginalised young people. And this is critical for us as we look at responses to COVID-19. It's also, I think, a really useful tool for us to be critically curious about the cultures that we foster and perpetuate within our own organisations. So we can ask useful questions of ourselves about whether we're reflecting the values amongst our workforce that we apply when we're working with young people, so that there's equality across the board, not just amongst the young people, but also the people that deliver those services. I think one of the really critical things that is an issue within our sector is the compartmentalising of young people's lived experience. And that's largely driven by funding, which is a competitive process. So what happens then is we tend to think of young people's needs in segments as opposed to taking that holistic view. So working through that intersectional lens helps us to develop a much more holistic process to our work. And on the back of that, it demands of us, I think, that we work collaboratively, that we work in partnership. So just a few examples from my own practice that hopefully illustrate how looking at the lived experience of young people and services can improve outcomes for young people. I was a young fathers worker for an organisation now called Future Men, but formerly called Working with Men. And there was a really poor take-up of services initially. So I spoke with colleagues to find out why that was. And the general feedback was that they're not interested, that they're not responsible, and why would they be their teenage fathers and still have the whole of their lives ahead of them? And there's quite some pejorative terms used in response to young dads. So then I did a survey with 50 young dads and asked them why they weren't taking up services and what they would like to see. And their responses were, well, we feel that services are very much structured towards the needs of the mothers of our children rather than ourselves. So that provided an opportunity for me and colleagues to look at some of the barriers to engagement from young fathers. And what was intersecting within that was their gender as young men, their age, and their role as young fathers, all compounded, which created a huge barrier to them being able to access services, because services were targeted at the needs of young mums. And through working with different services within Greenwich, what we were able to do then is review how we engaged with young fathers and create a service that was for young parents, not just young mums. And then the second example was from a project that Partnership for Young London delivered recently called Know Your Roots. Part of that project involved us talking to participants about school policy. This project looked at exploring and celebrating the virtues and beauty of black hair. And through some of the workshop sessions that we had with participants, they highlighted the school policy as being really a disadvantage to students of African descent and Caribbean descent. And they described the school policy as being culturally biased because they were being requested to wear their hair in ways that naturally conflicted with how black hair grows and how black hair needs to be protected. And when they sometimes challenged teachers, what they found was that situations very quickly escalated into disciplinary matters. And they felt that was because the response was feeding into wider narratives around race and gender. So when we looked at this particular situation through that intersectional lens, we could see that there was an overlap of the historical representation and perceptions of black hair, which have been racialized, and there's a historical legacy to that, overlaid with a cultural issue because the schools were not catering to the needs of all their students. It was culturally biased, overlaid with a gender issue that suggested that there was some kind of pathological behavior going on in terms of the way that young black women behaved. They were naturally aggressive and more inclined to get into arguments. So the overlap of all of those things helped us to understand what was going on in schools and school policy around dress and hair presentation. And we were able to open up this discussion to teachers and encourage them to review their school policies. And this isn't just an issue for the pupils that took part in our particular project. It's a universal issue, and there are other examples of what schools are doing to redress the balance. So before we move into a conversation and invite Maxine and Sarah to share their observations and concerns, with regards to COVID-19, we want to look at this through this intersectional lens. So when this crisis first came to the fore, it was very much presented as a medical crisis. And by and large, it's because of the efforts and the expertise and the determination of people working on the ground that it has now been reframed as, yes, a medical crisis, overlaid with a social crisis, overlaid with an economic one, a personal one, a cultural one, and a political one. The overlap of all those things has reinforced and compounded discrimination and oppression for different demographic groups. So looking at COVID-19 through that lens of intersectionality allows us to better understand how it's impacting different community groups, which will then make us more able and ready to respond effectively with our services. So on that note, if Maxine is with us.
I am.
Great, thank you.
Hello, everyone.
Hello.
Hi.
So as I said before, Maxine works at Young Brent Foundation.
Yeah.
And Maxine, I just wanted to invite you to talk about some of your concerns, first of all, with regards to education.
Yes.
And some of the assumptions that the government is making in terms of young people's ability to continue their education through homeschooling.
Thank you. Thank you, Sandra. And I really appreciate the fact that you stated earlier on that governments and policymakers don't really have a framework for understanding these overlapping disadvantages. And so we can see from those initial responses that came out from the government about their ideas for supporting young people, there was a huge assumption that education is a meritocracy, that those who want to work hard will all achieve their amazing dreams and get great qualifications. And we know for some young people that just isn't the case. And for our Black and African young people, the statistics already show that on average they are a year to a year and a half behind in terms of their white peers, and that much of that links to some of the issues around teachers undermarking children from ethnic communities. And so that has a significant impact going forward on this gap of potentially 6 months, adding to that layer of attainment that is already absent. And the measures that have been put into place again assume that everybody is at an equal footing economically. So if you're taking a variety of courses, including GCSEs, that you will have all the facilities available in the home at hand for you to be able to complete the work programme that's been sent out. Speaking to young Brent members, for many young people that's not the case. There are internet and broadband issues. There's print, having access to print, having access to an email. So for some young people, the way in which they would access any email work is at a library or in the school setting. And so we've heard of students who are aware of their peers who don't have the emails, who are then supporting them in addition to doing their work themselves. So from an educational standpoint, we're increasing the disadvantage by assuming that everyone is at the same position. There's also the analysis around gender. So how does the way in which young men and young women choose their courses, how is that impacting on, again, that ability to carry out work programs at home? So from a study, young men are still taking the physical, biological, computer science courses that may work better in this context. And young women are taking more of the creative programs still at GCSE course level. So how is that practical work going to be assessed in a home setting? So again, if the only media access that you have is within a school setting, you can't replicate that same quality at home. And so there'll be that additional disadvantage when it comes to teachers marking grades based on the way in which you've worked up until March. There'll be additional disadvantages for a lot of young people that we work with around those. So in all, it's not a great picture for children, young people who come from families experiencing economic disadvantage, children, young people from ethnic minorities, particularly Black Caribbean young men, are going to be significantly disadvantaged. And we know that there are, these issues are being highlighted to government departments, and we're still not seeing any response as to how we're going to close this 6-month gap and prevent that further adding to potentially a 2-year gap from their young white peers.
Right, so you've identified several different factors that are overlapping to reinforce disadvantage. You've talked about race, you've talked about gender, you've talked about economics. And what's clear from what you've said, you've really highlighted the need to disaggregate data around how this is impacting particular groups of young people, which is absolutely essential. I just wonder, in terms of what we can do as a sector, what do you think the next steps are in terms of responding to some of this need now that we've identified it? Because yes, we need to put pressure on the government, but there's also a huge role for civil society, which we've seen in terms of responding to some of these more vulnerable young people's needs. Can you possibly identify some things that you have done within your borough to respond to the needs of young men and young women facing some of the difficulties you've outlined?
Absolutely. We've already been having discussions about how, when the lockdown is over, and we're thinking potentially the summer time will be a period where organisations can really look to support this this gap in young people's studies. And again, I think the brilliant thing about the sector is how do we do that and keep it creative, making sure that young people have an opportunity to carry out some of those practical activities. So how can we work with small businesses who would enable young people who were perhaps doing a plumbing course to come in and speed up those opportunities that they've missed to do some of those practical exercises. So those existing partnerships and relationships that our organisations have, I think this is a great opportunity to work more collectively to ensure that these gaps are closed. Another thought we had, and I think this continues from the example you showed earlier about the hair project, and I think one of those great opportunities that existed within the hair project was, especially for our young women, was to draw out the science behind different hair types. So that's drawing on the creative aspect, but also ensuring that young women have an opportunity to explore much deeper using a science lens as to how the hair is different. So bringing arts and science together is another way that we can not only ensure that there's a broader curriculum based on gender, but also introduce new ways of seeing science.
Definitely, and also reinforcing the importance of creative approaches.
Yeah.
I was listening to Pragna Patel from Southall Black Sisters, and she talked about the importance of capturing people's stories and capturing memory within this current crisis, so that we have a record of how it's impacting people from their own standpoint.
Yeah.
And that will be critical in terms of how we move forward. And as a sector, working with the cultural sector and associated sectors to find creative responses to this in terms of how we manage the trauma that this is creating and how we respond to it. I'm going to take some questions shortly, but I would like to bring Sarah in before we do that. You've been sitting patiently, Sarah, thank you. I know that you have some concerns, again, around education and this whole prison to pipeline concept and how that particularly impacts young people of African descent. I just wonder if you could say a few words about that before we take some questions from the people in the session. Can you unmute your mic, Sarah?
Yeah, hello?
Hi, we can hear you.
Sorry about that. So first of all, I really thought that what Maxine said about the scientific aspect is really important, because again, Black children and young people mature physically quicker, which can contribute to them getting sexual abuse or even being discriminated against in school, in the workplace, etc. And in school, this can cause for young Black boys especially, them to be seen as aggressors, for them to be subject to more punishments and exclusions. And these exclusions can directly lead to prison, which can cause, again, a school to prison pipeline. So essentially, just by being born the way they are, these people are set up for failure. And this leads to distrust and disengagement for the rest of their adult lives, pretty much.
Mm-hmm. So again, it's being mindful of how behaviours can feed into wider stereotypes around how certain demographics of young people are, but also about young people themselves understanding the kind of the biology of how we are, and not making assumptions about behaviour based on physiology. That's also really critical.
Exactly. And I think, oh, sorry.
Go ahead.
I was just going to say, I think the angle of them actually living in fear, them internalizing media representations, things like that, that needs to be put as well, a rehabilitative angle rather than punishment.
Yeah, and I think we're going to come on to just talking about fear and trauma a bit later, but yes, that's a really important point as well. Just before we go ahead, do people have any questions in response to what they've heard so far, or observations or comments? If you do, could you put them in the chat and we'll take as many of them as we can. Troy will read them out. So if you could keep your mics on mute, that would be really helpful. Thank you. So Troy, do we have any questions?
No questions at the moment, but I'm sure more will come as this continues. So,
okay.
So, yeah.
All right then. So I wonder if we could move away from education and focus more on, again, lived experience. Sarah, could you share some of your thoughts around how COVID might impact young people who have experience of the care system? You're on mute. Can you unmute your mic? Sarah, can you unmute your mic, please?
It's not letting me.
Oh yeah, you're fine now.
Okay. Cool. So regarding COVID in this situation, so being in care, it needs to be understood that at this time, not everyone has a home that they can call a safe space. And again, in this situation, a lot of foster carers aren't actually equipped to deal with what's going on. So the move to homeschooling, for example, a lot of foster carers aren't equipped to deal with this, and it could cause more tense relationships at home and more tense environments. And this can really affect someone's mental health. So now we're overlapping the already negative experiences of, negative experiences of being in care with bringing in mental health issues at this time as well, which can really be detrimental to young people. So yeah.
So how do you think that government should be responding to this? It's a really big question, but from a practical point of view, what do you think needs to change in order to support young people who have experience of the care system?
Well, I think one thing is that in the care system, there's often a direct connection or link to poverty as well. Those often are synonymous, which means that a lot of people don't have the access or resources. So people in care often have less access and resources, even though they are entitled to more. So I think that what's really important is really drumming in the idea that you should ask for these things and that you deserve this access. I think that it should be mandated that young people in general, but particularly young people in care, should have access to a computer and internet at the very least. Maybe that could be a project or something. But yeah, I think that's really important.
You've also highlighted something within what you said about asking critical questions. I think as a sector, we need to create spaces in order to really challenge current policy and hold people to account. There's, and that includes us as a sector as well, really sustaining the current pressure on government to address some of these pre-existing inequalities. It's incumbent upon us as well as the government to ensure that this is something that's really tackled within this current crisis, so we don't get a replication somewhere else down the line and not learn from what we're currently experiencing. I just want to maybe bring Maxine now. You talked about fear earlier on and trauma. I wonder if you could say a bit more about that, which is obviously something that all young people will be facing to a lesser or greater degree right now. Could you explain a bit about some of your concerns around that and how we might be able to address it collectively?
Yeah, so this came through a conversation that we had a couple of weeks ago, and it was really just a question around if we've already had over the past few years and actually longer an environment, and when I use the word environment, I mean outdoor spaces, places, neighbourhoods where young people have experienced fear, a threat to their lives due to knife crime. So if that's been a perceived threat for young people, how has COVID-19 and the media coverage contributed to further and increased perceived threat to life? So what does that mean for young people who have feared going out and under the current conditions are being told that it's dangerous out there? And we know that over the weeks there's been increasing media coverage on Black, Asian, minority, ethnic people are more are the people who've been more at risk of COVID-19 and who've died as a result of it. How does this information contribute to mental health and well-being, and what does it do for young people's physiology in terms of that perceived threat, managing those stress levels on a day-to-day basis contributes to those existing health inequalities physically and mentally. And so for us as a sector, having this awareness should then mean that when we're thinking about programs or when we're carrying out group work with our young people, that it's not something that we ignore, that we have a discussion about how these situations impact on our bodies physically and mentally. And the other concern links to how fear is currently being weaponized. So we're seeing discussions increasing around surveillance and tracking of people using their mobile phones about where they've been. We know for our young people, this is a massive invasion of their privacy. And so on one side, it's being discussed as you'll be able to pick up on your phone if someone near to you has had COVID-19 or has been in an area where there's a high percentage of people with COVID-19. And if you're a young person of colour who those connections to surveillance mean many other things, as Zara's highlighted, that pipeline into prison, how is that also contributing to their fear, and how is it empowering them to feel valued if people then see that, oh, we know that Black and ethnic minorities are more likely to catch COVID-19 and die, so should I be moving away from you? And that sense of othering compounds this whole story of intersectionality for young people. So yeah, big questions, but I think this is what we should be discussing with our young people around their awareness of surveillance and how we should be democratizing their political awareness to ensure that they have a voice about how this is used and how this shapes their own identity going forward.
I think you've raised a really important point about the need to consult with those people who are at the sharp end of the impact of COVID-19, having those discussions with young people to understand the multiplicity of need there. As a sector, what else do you think we need to do in terms of shaping our services to meet some of these complex needs? And that's a question to Maxine and Sarah. It'd be really useful to hear your responses to that as well.
I think it's really important to be having these discussions with young people. So as well as, we know that over the past 10 years that funding has been channeled very much towards highly targeted interventions. And so the landscape looks very different than it did. There was a time when democracy, young people's voice, youth exchanges to other countries were a really key part of what youth organisations were leading on and were central to shaping local policies. And, that has been diminished significantly over time, so that, many of the issues that we're dealing with are so much more complex and highly specialised that the space to have these discussions, I would argue, doesn't exist to the extent that it used to. And so maybe one of the ways that we begin to claw back on some of this disappeared funding is to say, this is a really important piece. As you highlighted earlier, we should be capturing the stories now of how services need to be reset almost to ensuring that informal education recognises the space for young people to contribute to these decisions in a way that was seen and on a scale that was seen, potentially 15 years ago.
Okay. Sarah, have you got anything to add to that in terms of how we reframe services to deal with these complex issues?
Well, I think that the most important thing really is just education needs to be provided at a really young age and really early in the socialization process. I think that, so this could mean training for care experienced young people. Foster carers would need training. This means training in the education system as well, because people need to practice tolerance. And especially during pandemics, marginalized groups are always targeted disproportionately. If you look at AIDS, for example, that used to be referred as grid, gay relation or something. And education, like the contribution of science, the contribution of social awareness has now made that obsolete. Now people have to attach some sort of tolerance and respect to things. I think that's really important. Yeah, basically.
Okay.
I just want to add one more point about workforce development.
Yes.
We've been talking about it at some of the policy meetings with Partnership for Young London. And again, it's just now more than ever, there can't be an argument for not investing in workforce development at this time.
Okay, so Troy, actually I just want to open this up to everybody to hear your responses about how we can mobilise ourselves as a sector to deal with the specificities of different demographic groups and of young people and how they're being impacted by COVID. Maxine and Sarah have talked about creating a space to have those conversations, both with young people and with other strands within the sector, and that's something that we should be able to do relatively simple. But it's reliant on everybody working collaboratively. I just wonder what other strategies that we can use to capture some of the complexities about what young people are facing. Are there any questions, Troy?
There are, yeah. So from Emily, she says, I'm thinking about young people's mental health during and after coronavirus, particularly intersecting with experiences of disadvantage and discrimination. I was interested in speakers' thoughts on this, if they're hearing things from, and if they're hearing things from young people they work with. So young people's mental health during and after coronavirus, and how that intersects with disadvantage and discrimination. And Emily would like to hear your thoughts on this, or if they're hearing anything from young people.
One of the comments from a young person that really I've just felt was quite profound was that being at home with family that, you know, is clearly under pressure in terms of parents being at home, two things that they noticed was having an impact on their mental health. The first one was that they'd seen an increase in alcohol consumption at home. So, you know, he stated that it would usually start in the evenings, but because of this period of lockdown, that was starting earlier in the day at 12. And the second issue was that the longer that they're at home, the more responsibility that they have to take on. And so that feeling of taking on the mental health concerns and manifestations of the wider family was having an impact on their mental health.
Mm-hmm. Partnership for Young London. Sorry, did you want to say something, Sarah?
Yeah, sorry. I was just going to say that one thing that I've seen from young people in care is that because there's already a distrust with services or disenchantment or whatever, they are really reluctant to take any aid or to answer any calls in this time. So due to this, they basically, it's even though everyone's self-isolating, it's a real period of isolation for people in care in particular, because services are meant to be their corporate parents, and at this time they feel no engagement, they feel no connection, and can end up leaving the pandemic in a much worse position than they started off with. So yeah.
Okay, so Ebony's question was about looking at the intersection of race and mental health, and then this current crisis, and we've highlighted some examples of how that's impacting particular young people. We did a survey that about 80 young people responded to, just asking how they were managing their emotional well-being during this time. And the responses were very much around building up personal resilience, and looking for strategies within themselves and amongst their peer groups to really try and stay on top of how they were feeling with all this information overload. So we know that young people are finding strategies within themselves, but I just wonder what else we need to do to make our services, like counselling, like some of the online services that are being used that young people can check in with, to share how they're feeling. What else can we do to make our provision more accessible to wider groups of young people, knowing, as Sarah said, that some young people, particularly more marginalised groups have a real distrust of services because of previous experience. What else could we be doing to really kind of broaden the landscape and reach more young people with the limited services and resources that we currently have? Could I ask you to answer that, Maxine?
It's so, I mean, we had discussions around counselling online, and you know, there were two schools of thought that came from that. You know, one that, yes, it's a useful opportunity, but then how do you then safeguard a young person who, you know, following that online counselling session, you know, starts to decline emotionally, and so that but then the other side of the argument was, you know, that it's a useful tool nonetheless that should be available to have those counselling sessions online. Another issue that came up was the fact that for some young people, the mental health support that they are receiving has been within a school environment, so not necessarily provided by the school, but an organisation coming into the school, and that the schools are aware, therefore, of those young people who would be normally accessing that service. And something that they could offer would be for phone calls to those students who are in their schools. So I just think that, yes, it's great to be able to send someone an email, but how much more personal and vital would be that phone call from an individual who is aware of those young people who would have been receiving the mental health support if that couldn't continue. Mm-hmm. And so I think where there's that level of awareness, there are ways around making sure that those young people are still safe whilst we're going through this lockdown period.
Obviously no one has a panacea for all of the ills that are being created through this particular trauma. But one thing that we can learn from intersectionality is the importance of being seen. So a phone call may not be able to put strategies and solutions in place immediately, but it does enable young people to be reminded that they are recognised, they are seen, and we are concerned about them, and that they are connected. They remain connected, and we're watchful over what needs to happen next. So just simple phone calls and making that human connection is one strategy. I just wonder if people could tell us what other strategies that they are using, practical strategies, to engage with young people during this current time. We've had the example of the phone calls, counselling online. What else are people doing to stay connected with the groups that they would normally be working with face to face?
Sorry, I was just going to say that I think maybe training would be a good idea. So providing some online training or some like workshops to strengthen maybe family relationships at that time, because it could be a bit. Also, I think maybe training in like general education, because as we know, a lot of ethnic minorities are the essential workers right now. So it's often their children that are left in the worst positions at this time. Mm-hmm. Also, where being Black, and for me particularly being a woman, overlap, I think that training and education on things like hair is really important in this situation, and kind of opening young people up to projects such as the one that you did, the hair project, the Positives of Hair project. Yeah, I think that those, especially so gives you something to do at this time.
Yep, thank you, Sarah. So as a sector, more training around cultural awareness generally.
Yeah.
would be useful. And then Troy, I don't know if there are any questions in response to, any questions in response to what I just asked about other strategies that organisations are using?
Yeah, we've got quite a few. So Mind is distributing funds on support for mental health right now, including children and young people's children and young people's mental health. So yeah, there's a link in the chat, and we'll share that after this. We've also got somebody else saying that their organisation, for the person who said our organisation runs training sessions online, could you share your organisation? And essentially that training gives people daily tasks to complete on a weekly basis, and then making sure that the sessions are carried on and involving parents and other family members as well. Jude is saying our youth workers are making phone calls to young people, and they're also doing a film project as well, where they're filming themselves, and it's called Living Under Lockdown, and they're sending them in to be edited and to be created into a short film. Another person said Zoom sessions, Google Hangouts, challenges, competitions, just to keep everybody engaged. And yeah, thank you, Andrea. Track Academy, and let's see if there's anything else as well. How to make our services more accessible. They've invested training. Rio has invested training around social media, and they're also hoping to have an online presence on social media, and how to create that they're offering training on how to create that presence. And is there anything else? There's a few more comments, but I'm not sure how much time we've got left.
Well, we can take literally a couple of comments, and then it would be really useful to start to think about how intersectionality, our knowledge around intersectionality, can help us plan in terms of next steps as we move forward. So a couple of comments, and then we'll start to look at summing up. Do you have some comments, Troy?
Only got one more that just came through now. Just perhaps a creative corner in which young people's work will be published. Like that could be blogs, different things like that. Yeah, no more new comments at the moment.
Okay, so there's a lot of stuff going on, and I think the underlying common thread throughout all of it is just a common sense, staying in touch with young people and staying connected. In terms of how intersectionality informs us in planning ahead, how can it impact next steps? Maxine, I don't know if you could comment on that. How does applying an intersectional lens help us to plan what happens next in response to COVID-19?
I think many of the organisations that are in civil society were set up in many ways because of the gaps that they could see around them, and that going back to their mission, remembering why they decided that it was important for them to do the work that they're doing, and then working alongside to meet some of the gaps that they're experiencing. So we know that more and more organisations are finding the areas that perhaps they're not so strong on, and finding those organisations so that they can work to achieve better outcomes for young people. And so I think it's important at this stage to, more than before, become very curious. The crisis has highlighted, not just for governments and policymakers, but for all of us, the areas that that we need to improve on. And so, if we know, for example, that the programs that we've been delivering are to encourage diversity in sport, So making sure that, you know, there's a good balance of young women taking part in cricket, football, etc. How can we leverage in some of the learning gaps using, you know, a sports science angle to it? So again, just making sure that the bits that we do really well continue to do, but as a result of this crisis, where do we see gaps emerging for our young people? So if it is in the area of, you know, perceived threat continuing to invade young people's minds, you know, if you're a sports organisation, work alongside an organisation that does mental health really well, embed it into the programme so that relationships aren't held just with you, but young people begin to develop relationships with other people. If you have the expertise within your organisation, so the youth sector isn't one homogenous group. We come from so many varied backgrounds. Be curious about what else your existing staff bring. So, you know, if there's a geographer in the organisation, how do they understand using the bit about identity and place into those existing activities? Just continue to be curious, add different flavours to your work, share those stories so that people can see the amazing work that we do already, and add it into those funding applications. So if you are a micro organisation delivering, you know, that your turnover is under £10,000, we know that there are tech companies who provide free software, free laptops, free systems where you can start to capture some of your data. So, which again will add added value to not only increasing the skills of the people in the organisation, but also you've got evidence of the stories that you've been capturing, of the amazing variety of people that you've been supporting that you would never have supported, and you're beginning to widen the engagement of your the people that you're supporting now.
So lots of really practical suggestions. It can feel really overwhelming. So it sounds like this is a key opportunity to just stop actually, or at least pause and take stock about the way that we're delivering work and going back to our original mission, and reviewing that, and maybe using that as the starting point is really useful. And then you talked about just asking questions, being critically curious about the service that we provide, and then maybe looking at some of those big social categories like race and gender and thinking, well, if I am going to produce a project around employment or sport, how does race impact my offer? How does gender on top of race impact the offer, and social class? And just drilling down a bit and really asking candid questions about whether we are enabling a good take up of the services that we have. Working in collaboration, looking for expertise elsewhere, and being able to complement what other services are doing is really key. And yeah, just making that work more collaborative. But I think the first thing is to pause maybe and take stock, as you say, and just remember why your project came into existence in the first place, and then moving steadily forward. Sarah, have you got any points to add in terms of how intersectionality informs what we do next in response to COVID-19?
I think that intersectionality needs to be taught as a concept at a start, because I really think that the idea of not seeing color, not seeing gender, not seeing these intersectionalities is more dangerous than just seeing them, appreciating them, and adapting society for them. I think it's the most important thing for young people is participation. So showing them positive role models so that they're encouraged to do so. And also, I think really pushing like affirmative action programs or university programs onto diverse groups of young people, so that because they need to be in high positions in society for a change to actually be made. I think young people need to be part of the change.
Okay, absolutely. So that brings in that important principle of self-agency and self-empowerment within the discussion, and that can happen through consultation with young people. You mentioned the AIDS crisis from several decades ago, and one of the key positive outcomes out of that crisis in terms of how to respond to similar situations is to consult the people who are most directly affected. So consultation is key, but the responsibility then should be shared.
Yeah.
Okay, so we've got about 20 minutes left. So in summing up, we've already talked about getting critically curious and just asking a series of questions. And I think it's really important for us to remember that this isn't a tidy concept. Intersectionality is a tool that just enables us to be more specific about our services and who's accessing them. So as I said before, just looking at some of those wider social categories and asking what happens if this is layered with race or gender or class or sexual orientation, and then how does that impact accessibility for certain groups of young people, and asking that critical question, what is intersecting? It's not going to be the same at any given time. So it's important for us to build in periods of reflection as we move forward, so that we can keep reviewing and amending our services, because this is a malleable thing. It's very fluid at the moment. It's changing day to day. So it's building in those opportunities to keep reviewing what we're doing and keep consulting with young people and getting, as we've said, critically curious. I just want to give one final opportunity for people to share comments, observations, or ask questions, particularly in response to the question, how does intersectionality inform next steps in terms of responding to COVID-19? Any last responses to that?
I'm not sure if these are responses to it, but just more so like comments in terms of what people are doing across the sector right now. So Kay has said, Kay, who works at Ealing Youth Justice, they're currently creating Google Classrooms which are on different topics such as knife crime, exploitation, COVID-19, exercise, and they're in contact with the young people 3 times a week. They also have a food bank, outreach, and mental health support for those who are high risk. Aine has said Sandra has been delivering workshops for youth work students at London Met Uni, and there's a positive feedback in terms of how students are applying the model on intersectionality and how it's enabling their practice. Sarah has just said, Nick, at my bank, they've started live broadcasts across social media called My Moneycast, with the aim of young people speaking about their experiences during COVID, and young people can send their experiences to Nick, and that will be featured on the podcast live Q&A. So yeah, get in contact with Nick. Shima says one thing that our young people need are positive, relatable role models during this time, which I think is quite important. And Sarah has also said Karam are offering 6 creative writing workshops via Zoom, and that starts on Monday, May 5th. and that's about goal setting and stigmas around young care experience people aged 16 to 25. And Sarah shared the email for that as well. It's cheryl.campbell@coroma. Okay, and you can see all this in the chat. Oh, last week we've got two more. Denise.
Can't hear you very well, Troy.
Can you hear me now?
That's better.
Yeah. Denise said sharing up-to-date information on our platform, the Romanian and English language, as well as offering support in both languages with any queries held, which is quite useful. And Maddie has just said, I think there needs to be an acknowledgement that COVID-19 not impacted all people in the same way moving forward. Some young people are going to need more support following it.
Mm-hmm.
Absolutely.
And that's that.
Yeah, I mean, that final point is the most critical one, if you like. And if it wasn't explicit, let's make it explicit now that COVID-19 impacts us all, but it will be impacting us all in different ways. And we have to really hold on to that in terms of how we're shaping our services. Most things are happening online at the moment, understandably so. But I want to come back to the point that Maxine and Sarah made earlier on, that not everybody has access to the internet, not everybody has the space to be able to sit down and focus their minds on what opportunities are out there. There isn't one solution to this, but one of the critical things that I think we need to think about is how we reach those young people. And it might be that we have to team up with sectors that we haven't worked with before, but finding other channels that we know the least engaged at the moment because of these practical reasons. We need to find ways to talk to them, and it might not be online. So what other opportunities can we create with the resources that we have to include them in our current offer and as we move forward? And then the other thing, I'm not sure who said it, but also making sure that any information that we put out there is accessible to young people that don't have English as a first language, or who use other means of communication, young people with disabilities. How, these are rhetorical questions at the moment, but how are we able to engage with them and make our services inclusive to them? So lots of things to think about, lots of unanswered questions, but obviously this is the space to start finding solutions to some of the more difficult things that we face at the moment. So in coming to an end, I just want to ask Maxine and Sarah if you've got any final points that you'd like to leave with people based on the discussion so far, or anything else that's come up that you think that we need to be considering as we move forward.
I think, you know, the choices that we have to make are that we see this crisis as you know, nothing but more damaging, or B, that we use this as an opportunity to ensure that, you know, the pause has given us time to rethink and redesign and really question and assess the programs that are being delivered, and assess it based on the way that it contributes to these areas changing for young people. So, you know, how are we ensuring that young people, that the work that we do with young people improves their capacity to secure better incomes for themselves? So, you know, having those things in mind, I think will offer new opportunities to work a bit differently.
Mm-hmm. And employment is a real critical factor for a lot of people, young people right now, most definitely. You touched on something else that I think is important to leave with people as well, which is looking at the resources within your staff team. There may well be skills, knowledge, certainly lived experience within your staff team that we are not aware of at the moment. So this is also an opportunity to sit down and look at how all of that knowledge, that wealth of experience can really inform how we move ahead. Because remember, a lot of our colleagues, hopefully all of us, we came into this sector because of some kind of vocational calling, if you like, for some of us. And so it's looking at what that can now bring to this particular situation. A lot of staff have lived experience about the very inequalities that young people now face. How can we utilize some of that knowledge to really improve outcomes for young people as well? Sarah, have you got any final points that you'd like to make?
Yeah, I was just going to finally say that I think one thing that we need to know as well is that COVID is it's a good time to let the privileged kind of experience some level of like underprivileged at this time, and for them to be able to, because the privileged generally have the biggest platforms and the biggest voices. So it's a good time to link up with them at this time. But I also think it's important to note that some people that are underprivileged or marginalized still may be feeling a sense of privilege in things like a global pandemic, because although they are underprivileged by our society standards, maybe globally they could be thinking, oh, at least I've got a roof over my head and things like that. And that can really affect someone's mental health, and that can also make people feel guilty or something. So I think that needs to be focused on as well.
Yeah, that's really important. Guilt is part of the trauma. It's part of managing young people's mental health and managing the process of trauma and how that impacts people. But you also mentioned something else, Sarah, that I want to pick up on, which is who sits around the table when we're having these discussions. So at the top of the session, we talked about how it's because of the input from people working at a grassroots level up that the government have now reframed this crisis to make it an intersectional one. And in terms of how we move forward, we also need to have diverse voices around the table in terms of planning ahead. So this is one space where we do want people from different ethnic groups to be around the table, people who experience different levels of access and equality around the table on all points in that particular spectrum, to share their experiences so that we work together. Because sadly, and not in this case looking at the makeup of the group, but quite often when we're talking about issues of equalities, it's the same voices around the table, which just creates echo chambers. So again, this is an opportunity to really open out the space and talk to a wider audience about the impact of some of the issues we've been discussing today. So just finally, one last Mentimeter, just to get your responses to what you'd like to see happen next in terms of events, what's been useful about this session, and then in order to create some connection between us all, because we couldn't all see each other, any words of wisdom for your peers in terms of dealing with the current crisis. Practical, funny, serious, whatever you choose, or however you choose to respond.
Yes. Oh yeah, brilliant.
So I think these are word clouds, so it's just your initial responses to that, and we can all feed into that. And while you're doing that, I'd just like to say thank you very much for joining us on the session. It's the first one of these that I've done. I really appreciate you taking the time, especially on a Friday, end of the week, to help us to really kind of focus our minds in terms of how we deal with this practically and strategically, but with positivity as well. It's hard to talk about COVID-19 and opportunity in the same sentence, but we do have to see the opportunity in this and the hope for improving outcomes for young people, to motivate us and mobilize us into action. Thanks very much, everyone. That's really reassuring. That's great. Definitely, definitely. I don't think we can underestimate reflection and reviewing and amending, and also looking at where we're making mistakes and reviewing those as well. This is a learning process. We haven't experienced this before in the same form. So definitely about building safe spaces to learn and make mistakes and improve our practice. Okay, just move on to the next one. I'm not sure if people are doing this one. Are you able to access the Mentimeter to do this one? Yes. I'm so impatient. Thank you. Yeah, consultation, more case studies, definitely. I think we've learnt that from previous crises that we need to consult with young people, but the responsibility needs to be shared. The onus can't be solely on them. Building connections, working in partnership, definitely. Thank you. And I'm going to move on to the final question. Any words of wisdom? Oh, there's more. Just a few more moments on this one. Thank you. And the final one as we come up to 12:30. Oh no, we have time. Yes, identifying priorities, definitely. We haven't touched explicitly on issues like domestic abuse, although Sarah did mention in your presentation that for some young people, as we know, home is the least space environment in their lives. So definitely teaming up with other sectors, and Maxine, you've talked about that as well, is critical. So the final one, please, yes, definitely. It's really interesting learning how people are coping with this. Some people are far busier than they normally would be, and sleep is just a kind of distant memory for some of us, and then for others we have too much time. So any words of wisdom to help cope with all of these kind of different needs at the moment would be most welcome. Yes, connection, that's fundamental, definitely. Definitely, definitely. And again, we haven't talked explicitly about emotion, but compassion is at the core of this work, at the heart of this work. It is about empathy and about compassion, and also about working with other young people other people in young people's networks. So, Sarah, you talked about working with families, which is also critical. Tapping into those networks. Just a few more moments on this final slide, and then we'll come to a close. So just in the last few minutes, I'd just like to thank you again for coming to this session. Thank you so much, Maxine. Maxine Willits from Young Brent Foundation, and to you, Sarah. I'm really grateful for the contributions that you made. Really grateful to you all for attending, and we hope to see you again next time. Thank you too to you, Troy, in the engine room with the questions. Really grateful.
No worries. My pleasure. My pleasure. Thank you.
Okay. So I'm going to stay on the line, but we've come to a close now. I'm not going to come out of the meeting because I don't want to lose all of the data. So I'll stay here for a little while, but I'm just going to formally close the meeting now at just coming up to 12:30. Thanks very much, everyone.
Thank you. Take care, everyone.
Thank you.
Bye. Bye.
Bye-bye.
Thank you, Sandra. See you all.
Eek.
Sorry, I'm just quickly adding something to the chat.
Oh, please do.
Because yesterday I had a participation network meeting, and they gave a lot of resources that they're doing to help young people.
Hi, Kashima. How are you?
I'm not too bad, my dear. How are you?
I'm good, thank you. Good to see you. I can't actually hear you.
No, I'm just waiting to see. I said I'm waiting to see the resources
Can't hear you,
that
Kashima.
may be available.
Can't hear you.
Kashima's saying that you should call her after this. She said that you should call her after this.
Okay. So we still have 7 participants with us. I think we're still filling in the words of wisdom, which is great. Okay. Still have a few people with us. Sorry. Whoops. Ooh. Oh, not sure what I've done there. Sorry. Apologies if you were filling that in and I cut you off. I think I've lost it now. But it is 12:30. So do get in touch if you have any further questions. My details are, I think, on the penultimate slide. They're here. It's just after 12:30 now, so I think we'll close. Thank you very much, everyone, for your time. Troy, could I just double check with you that we saved the chat? For
Yeah, chat is saved, and I'm about to stop the recording now.
Okay, thank you. Thanks very much, everyone.